And
So,
I know some people still like to stick their head in the sand or really believe in that siloed mentality, but
yeah,
truly there has to be a whole governance of um, looking at things as a whole, with other entities that have your best interest as well. You have things like the Change Healthcare incident, but you also have other critical infrastructures such as the Colonial Pipeline. And so looking at it from, especially in the healthcare arena is so critical. Well, healthcare, of course, prioritizes patient requirements because we're ultimately responsible for patient care. Our goal is to work alongside patients to make sure that they're getting what they need to remain healthy or for whatever type of issue that they have. It
sure.
used to be that you would tell provider symptoms and they may bring out a book and try to see what those symptoms would fit with. And where with AI, you may be able to use those symptoms and determine right away what the diagnosis may be.
Welcome to Digital Health Transformers, a podcast series. In this podcast, we explore the dynamic world of healthcare innovation, one conversation at a time. I'm your host, Bryce Barger, and today we have an all-inspiring guest at the forefront of transforming the healthcare landscape. We are thrilled to welcome our guest of today's podcast, Jessica Chastain. Jessica, CTO and Director of IT at Klamath Health Partnership, holds a vast experience of nearly a decade in information technology. With multiple certifications to her credit, Jessica is proficient at managing the various IT domains with her department. She has a clear vision of leveraging robust and cutting-edge technology in Klamath Health Partnership to ensure seamless operations and help the practice achieve its goals. Jessica also values collaboration and innovation that drive success outcomes in her IT domain. Her work at Klamath Health Partners includes managing IT budgets, vendors, staff, and ensuring compliance with IT standards and protocols. Klamath Health Partnerships is known for providing care to underserved communities, including individuals from low-income families, elderly, disabled children, developmentally disabled, immigrants working in poor and mentally ill. They also aim to provide preventative and primary care to these communities as well. Join us today in this discussion with Jessica as we delve into her journey and explore her perspective patient-centered services. Thank you so much today for joining us. How are you today, Jessica?
I'm doing great. Thank you for having me.
Yeah, I appreciate your time. I appreciate you bearing with me. It's always a challenge, I feel, to get through these intros. I you every single person I interview has such a fantastic and distinguished background, and you are no different. So we really appreciate your time and definitely look forward to kind of delving into this journey. As we always do, we like to start with the professional and personal story. Um, with almost a decade of experience in the IT field, Jessica, what are kind of the most complicated challenges you face in your professional journey? I know that's kind of a we'll kind of start and jump right into it.
There's actually quite a few things and challenges that I've faced. First is staying relevant. Uh,
Yeah,
it's so hard. When I first started in IT was just IT. You had your computers, basic networks, and there wasn't as many threats in the landscape like there is today. Uh,
right.
and so, I originally went to school, got a dual degree in accounting and management information systems, and then went right away into doing my MBA with a computer science emphasis. I'm actually finding myself now going back to school, getting a second master's in cybersecurity just because of the way the threat landscape is and trying to remain relevant. It's exploded. The IT field has, and instead of, like I said, just being IT, you now have all these specialties uh, that are critical due to everything that's going on uh, in the cyber world.
Yeah. And speaking to that, kind of that cybersecurity threat and that journey, can of how has that journey been just briefly? I know um just briefly, what has that kind of been like getting into that field? It's always something that's interested me as well with um I actually just recently, not to go off on a tangent, but we recently watched a kind of a documentary describing 0 days and all of these different threats, and was so intrigued by that. Kind of what has that journey been like briefly?
So it's actually been really rewarding. I actually started out, I was the IT director for Klamath County, our government sector, for about 8 years. And I started building a lot of relationships at the state and federal level, along with other local localities. And a lot of those partnerships had to do because of cyber. And that's where I really got interested. um, I have been involved in some different cyber attacks due to the length of time I've been in IT because it's not a matter of if, it's a matter of when. And
100%.
I know some people still like to stick their head in the sand or really believe in that siloed mentality, but
Yeah.
truly, there has to be a whole governance of um, looking at things as a whole, with other entities that have your best interest as well. And so some of the initiatives I've been with on the cyber side is I'm part of the Oregon Cyber Disruption Planning Work Group. I'm actually the local chair for that, and that's a holistic approach to cyber throughout the state of Oregon. And then I'm also was appointed by the governor to be on the Center for Cyber Excellence Council for the state. And we look at different training initiatives for localities around Oregon.
I know with what happened with Change Healthcare recently was kind of eye-opening. My not sure at all what all went down in that recent attack, but I know that one thing that had at least hit close to home or my household was my wife's a pharmacist, and she said that they had a ton of challenges by getting people their pharma that they're checking and like I guess running the insurances or being able to process the medications was like a huge deal, and it was down for weeks and weeks at a time. So it was very scary. So hearing, I know it was a small tangent, but I'm always very interested when I hear people who are interested and are in the cybersecurity space and hearing that background. You're a very impressive background. That's fantastic to hear.
Yeah, no, it's important. Yeah, you have things like the Change Healthcare incident, but you also have other critical infrastructures to, such as the Colonial Pipeline. And so looking at it from, especially in the healthcare arena is so critical. And it's, it's really needed.
Yeah, for sure. Can you kind of share with us any, I know maybe some that pivotal moment or maybe any pivotal moment in your healthcare IT career with Klamath or with kind of that has maybe um, that pivotal moment that really shifted your vision of healthcare in the IT field?
So when I came on to Klamath Health Partnership, it was uh, what I have found is that the healthcare sector tends to, they want to be on the, edge of technology, but in some ways, especially in a rural setting like I'm in, we're actually a little bit behind. And
Wow.
so trying to, what's kind of been pivotal at this agency is really getting us back to what I would consider normal operating, operating and then progressing forward so that we can better meet our patient needs, especially since we have such a diverse patient population and the type of people that we serve.
And kind of getting into the perfect kind of segue, getting into the patient's needs and kind of healthcare delivery. How do healthcare practices prioritize patients' requirements, and how does kind of healthcare delivery get impacted by all of that?
Well, healthcare, of course, prioritizes patient requirements because we're ultimately responsible for patient care. Our goal is to work alongside patients to make sure that they're getting what they need to remain healthy or for whatever type of issue that they have. And I believe and I have found that here at this organization, our healthcare delivery, we look at it more holistically. So in our agency, we actually do primary care, dental, we have behavioral health, we have a pharmacy, and we go as far as delivering medications to those that cannot come pick them up. We provide patient services, getting patients rides to their appointments, and trying to make sure that we meet the patient wherever they're at and making sure that they are a priority because they need people that will advocate for them, and we want to advocate for those.
Yeah, that's such a it is such a huge need in being able to serve the underserved population. I mean, that is it's such a need in America alone, let alone the world, but just here in our own country that is so often looked by. That's such fantastic work. What
It
is
it
kind of
is.
yeah, yeah, and
I just was going to say it is, and that's
yeah,
why this agency has been such a fulfilling role for me because such it's I take pride in what I do, and my goal has always been to help others, and this has really been able to drive my personal goals and missions with being able to help others that otherwise wouldn't get the help that they need.
for sure. Yeah, and I think it's weird. I think everybody when we were all 6 or 7 years old, if you will, if you go back and a lot of us, or at least I'll speak for myself, or I was so interested. I wanted to be a nurse. I was like, I want to help people. And then I got diagnosed with diabetes when I was 10, and I was like, oh, I'm gonna go into medicine. This is my life now. I want this, um, and then whenever I got to school, I was like, realizing it's not really. I was like, I want to make a difference in people's lives. Like it gets me out of bed in the morning. That's what I want to do with a job, and um, I eventually, after kind of not becoming a nurse and getting into the sales role, because I just don't think it was really meant for me, but I still wanted to do that. And I wanted to focus in healthcare still. And no matter how small, whether it be, connecting a patient with a mental health provider or addiction provider, or whether it be creating a solution like with OSP to help a local um, urgent care, help their efficiency tenfold and really be able to serve more and more of their community, is what a lot of us get into it, but I think a lot of it gets lost where once you get into the field, it's easy to get lost and go different routes where you lose that aspect of the patient and the patient first and seeing, you know, you guys' journey, what you guys focus in is so rewarding, and I know, and I can see it in your face whenever you said that it's just kind of um just so rewarding to hear. And I urge everybody to kind of just take a step back. If you're in this healthcare world and maybe just think about the patient again. Maybe make sure that's a bullet point on all of your list because it is really really important and truly what all of us are here for. We're all here to make money and to be a business and understand that. But honestly, like what we're here for is to make a difference in these people's lives um and take ownership and of kind of everything. So I really really love that approach from you guys and the role of IT in that. right? Like the role of IT and technology in patient-centric care. What what are your views about implementing current emerging technologies like AI or VR and AR to really boost more patient-centric care? I know we just the last podcast we just did, we spoke with North Star Care who did addiction and mental health with VR. They have VR goggles that they'll send out to the client instead of them having to come to their AA meetings, right? They do them over VR. So what are some of those, what are your kind of views about implementing current emerging technologies like that?
I'm currently researching how we can utilize AI more within our agency. Uh, there's a lot of use case for it. However, you have to make sure before you do that, of course, that you do the research, that you put
Yes.
appropriate policies in place, because some of that you want to make sure that your patient's data is safe, and you don't want to open up Pandora's box, because AI is constantly learning, and so if it's learning the correct information, it's going to be very helpful. But if it starts to get poisoned per se, then it could really take a drastic um, turn for your agency.
Quickly as well.
And so we are looking more and more into that, though, because it would help providers. Um,
For
it
sure.
used to be that you would tell provider symptoms and they may bring out a book and try to see what those symptoms would fit with. And where with AI, you may be able to use those symptoms and determine right away what the diagnosis may be, just ideas. And then going from there, the doctor being able to vet that, or using AI for, patients to kind of look at symptoms to see if it's something that's urgent that they need to see a provider for. Um, VR and AR, I think, also could play an important role, like you said. Um, we haven't implemented anything like that. We do offer some telehealth,
Yeah.
but it's not because of the patient population that we see. We haven't really started to utilize those kind of resources yet.
Right, for
Um,
sure.
but we do want to make sure that we're boosting patient care, that we're being timely with them, and we're meeting their expectation and goals. And there's definitely those technologies that really can drive that, where in the past, society was a little bit slower paced and people wanted that face to face time. But as we've progressed, people want that more instant gratification, and especially after COVID and not always seeing people face to face, it's more driving towards uh, telehealth and not necessarily being in the office. And so utilizing current emerging technologies is going to be critical in those roles moving forward.
Yeah, for sure. You're actually the second person today that I've even heard talk about how COVID really, like those technologies have been there, the telehealth, the RPM, a lot of these technologies have been there. But since COVID, it really it shined that light and gave whether it be the infrastructure or the funding or whatever it might be, or the just even the eyeballs on the technology to say, hey, this is so useful. And you're right, we haven't really looked back since. And
Yeah,
another,
yeah. I mean, you took, when things started to shut down, you pretty much almost overnight had to have solutions in place.
yeah,
And so, yeah, it's really driven and shifted everything from the first day of shutdown.
yeah. Another thing that I think is very interesting, and what you're starting to now see, and this kind of speaks to your point where how things were a lot slower. We can even say pre-COVID, but even before then, of course, right? Where it's very, I'm coming to my doctor's appointment. I'm going to sit down for 20 minutes or 15 minutes, and he's going to feed me with a fire hose, and I'm going to get out of there. And with the population that's continuing to grow, and even in the future of of kids and kids like myself and younger adults who have all this experience using all these technologies, that there's not this learning curve that has to take place. That I'm so excited to see what the future holds for kind of the future of technology in healthcare, because um, even I've been I think I might have mentioned earlier, I've been a diabetic since I was 10 years old, and have was been on an insulin pump when I was a child, and then went back to the needles, and kind of was seeing my endocrinologist every 3 months, just like a normal good diabetic, right? A good diabetic. And I would consider myself well controlled. And then I met my wife, who is a pharmacist, and she's like, "Hey, you have you not heard about Deck? Why are you not on an insulin pump? Why are you not on X, Y, and Z with all these technologies?" And got me on a closed loop system with Dexcom and all of these things. And it's just like really incredible how much better my care has been using these technologies, where I thought I was fine. But it's like now I'm taking a whole nother step with that I didn't really know was
Right.
possible. So it's so
Well,
so
to kind of go with that, for example, you can even get, y- where you can record your blood pressure with blood pressure monitors on, through Bluetooth. And so that
yeah.
way it makes it easier for you to share with your provider. And so you have a lot of different technologies that I think are really going to shape healthcare moving forward.
Yeah, for sure. For sure. And kind of getting into that, the digital health and kind of the other um, future trends for patient care. What I know we have more adoption of these technologies. They're just like the Dexcom, just like what you're talking about with the blood pressure cuffs and the Bluetooth technologies, and then being able to kind of communicate. What technologies like telemedicine and wearable devices, do you think these innovations will reshape the delivery of patient-centric care, and kind of how is that process going to look?
I think it definitely will. I think it's going to, for example, Fitbit or Garmin's that are recording, your sleeping patterns or your heart rate, how active you are. That's all I think going to be technology that's going to be able to be leveraged and shared with providers so that they can keep more of an eye of what's going on, or they have a record. So when that you go, they can help assist you with whatever kind of issue you are having. Um,
Yeah,
and I think it's going to, especially since we have generations that are coming up that are familiar with technology and they love technology. I mean, I remember when I was young, we didn't have cell phones. We didn't,
yeah,
it was exciting if you had a computer in your home.
yeah,
And, now technology is in everybody's hands and being utilized that I think is going to definitely shape and change the way healthcare is provided and how it is offered. It's going to really help too with telemedicine because instead of having, like I said, if you have a blood pressure monitor that has Bluetooth, you know, they're they're going to have applications that can feed that to your provider, and so you could even take your blood pressure for them while you're seeing them through telemedicine and then providing different types of statistics.
yeah. It's crazy to be able to almost provide what used to be on hands procedures in now over truly over the web completely, where it's like, well, no, I have an RPM device, I will just do it myself and send you the information and just tell me. It's so
Yeah,
um it's weird because it seems so like duh, right? But it's just like
yeah,
it's just something has never really been implemented until now, until COVID kind of forced our hands. It really did. It wasn't because that technology was there in 2019, or a lot of it. It's like it's funny how kind of happens. Can you kind of, as healthcare becomes more increasingly data driven, how do you balance the benefits of leveraging patient data for personalized care with ensuring privacy and data security as well?
well, things need to be data driven. That's how you can tell if you're being successful as an organization. And
Yeah,
so there's ways to be data driven and ensure privacy and data security, and that's having your policies in place, making sure that if you're looking at statistical data, that it's not pulling in any kind of identifiers,
Right.
so that you have that security and privacy. Along with that, you need to make sure that you have applications and products that have been vetted and have strong security focus in place. It's no longer the days where you can just go buy something off the shelf and expect that it's going to work. Um, you actually need to take a look at the security posture of the application, of the IoT device, of the vendor, to ensure that things are safeguarded as as much as you can, and make sure that you aren't also making sure you have proper security in place within your data center and your environment, to so that you aren't risking patient privacy and data security. Because
Yeah.
that's critical. If data gets out about a patient, that could be have life altering. Um,
100%. Yeah.
because I mean, you have access to what they're being seen for, what kind of possibly diseases they have, or what kind
Yeah.
of issues, and that can definitely change someone's life if it is exposed.
For sure. Yeah. I think I think when a lot of people don't realize that when they say like, okay, well, you get my medical records. Oh, okay, it's not the end of the world. But a lot of people don't look at it in the same lights as if you had a chronic illness or an illness that has such terrible stigmas with it, or any of these things. That is, it's very important to people and very private. That I
Yeah,
think a
it's
lot of
the
people
type of
kind of just,
data.
yeah, goes over their heads.
It's data that can be weaponized and
Yeah, for
can be
sure.
utilized to really blackmail or
Mm,
change, have
yeah.
huge impacts to people.
Yeah. Which is why, I think, which is why you see these attacks, which is why I think you see a lot of these attacks on these. I think some of them might be infrastructural based, right, to try to disrupt it, but a lot of them could be malicious and could be very um, information driven, where, so by these bad actors. Are there
Well,
kind
yeah,
of,
and I just was going to say, there's
yeah,
going
go
to
ahead.
be huge cyber components and more going forward. And
Oh, yeah.
so, healthcare is a major target. And on the dark web, healthcare data is very lucrative and
Yes.
getting sold for large sums of money.
Yeah. Yeah, definitely a scary and just like as you started the podcast, where it's not a matter of if, it's when. It's especially with the infrastructure that a lot of these current companies, whether they be healthcare, whether they be direct, as far as like water sources, or any of these like kind of I'm looking for kind of necessary and important systems around the country, whether it be lighting, all of these things, power, the power grid, all these things. The way our infrastructure is currently is so far behind that it's terrifying, and that it truly is a matter of when we're kind of hit, and having um, at least having um, our healthcare, so people having their eyes open, and being diligent about these things is very important. And and I think it's unfortunately one of those things where people's eyes are going to be opened when something happens. And truly, unfortunately, as far as many of us are being preventative and trying to spread awareness, um it's just kind of just it's an interesting path. But um
Yes.
I always like to kind of end the call. And that's the last question I had for you, but getting kind of the future of Klamath, and kind of what you guys, maybe any interesting um, visions you guys are currently looking to implement kind of in the next couple of years, or anything you can share with us as kind of a lasting living bullet point?
Yeah, so kind of what our goals are for the next couple of years is, making sure that we have a up to date, if not, and future forward environment. And that's going to include dashboards that provide data so that we can make better business decisions and make sure that we're meeting our patients' needs. And then also utilizing technologies like AI and making sure that we can kind of shape our organization for the future.
Yeah, for sure. Yeah, thank you so much for that. Thank you, Jessica, for really sharing your perspective on that patient centered care, and it's always a pleasure kind of exploring these different specific areas, and learning more about Klamath Health and kind of what you guys are doing to provide care to the underserved communities, and promoting health equity is it's really important. It's an important thing that I'm happy and glad that I could help share light on, and really appreciate you kind of shining that light and allowing us to be able to share that with the listeners today. Because your expertise and vision in the IT field, it's inspiring. It's always inspiring to meet people who um, do this for the right reasons, right? You're definitely, I can tell you're definitely one of those people. So we look forward to seeing your continued impact on the community, and learning more about Klamath here in the future.
All right. Thank you for having me.